is ultimately we need the ICWP rate to match the CCSP and source rate. So we want to take the blue and green bars, that is the levels 1 and 2 of ICWP, and get them to match the blue bar on the CCSP and source. That's, I believe it's called the extended rate for source, around $17 an hour. I'd have to look it up exactly, but it's on the chart. And then we want the yellow bar, or the level 3 for ICWP, to be representative of that slightly higher rate in CCSP and source. I have asked the Department of Community Health and am awaiting the exact cost projections. I heard from Marcy Alter yesterday, and we hope that she hopes that she can have that to me by this week. But ultimately, we are asking for anything that you can do to implement in the budget to help those of us in crisis so that we can find, hire, and keep qualified caregivers. There's a young man on here reflected, Mr. Minix, and he can't even find caregivers that can pass the background check. If I may be so blunt, you do get what you pay for, and that's the issue I'm having. I want to continue to be here before you daily at the Capitol to represent this and other issues facing the disability community. So I respectfully ask that this committee consider this request, and the specific ask, we're recommending an incremental increase of $3 an hour of an increase for the fiscal year 2017, with the potential budget impact just under $8 million. But as I said, once I get those exact cost projections from DCH, I will be more than happy to share those with you all. But those are my requests, and of the Unlock campaign, which I also represent. I thank you again for your time, and I would be happy to entertain any questions from the committee at this time.
Thank you for your testimony. I appreciate it. Any questions from any of the members? All right.
Are there matching funds for this? Do you know, are there federal matching funds?
Yes.
Federal matching funds for this?
Right, for any Medicaid waiver,
right.
For any amount of state dollars, right, there are federal matching funds from the FMAP.
FMAP, so 3 to 1. Okay.
Yes, sir.
Great.
Thank you.
Who's at 34? All right. Representative Petrie, go ahead.
Thank you, and not a question, but really just a comment. I'm a provider of services, Dawn, as you know, and serve folks in the aging sector, have for well over 25 years, and developmentally disabled as well, independent care waiver. I actually do not serve. Just to echo what you're saying, we don't serve the independent care waiver because we lose money when we do so. And so the rates certainly are inadequate to attract good quality providers. And so what you get, and to my colleagues, what you often see with providers that serve that population are providers that are willing to cut corners because that's the only way to actually make a living. So one other thing that I would emphasize, and that is something that's going to actually, bad news, unfortunately, make this worse, and that is the Obama administration this year has struck the companion exemption from the books, something that has existed in this country since 1938 when the Fair Labor Standards Act was passed. We had the ability to exempt home care workers from overtime for certain tasks. That has been struck down by the administration without Congress, and it now requires us to pay, and this is a bigger issue for you, Dawn, requires now that we pay caregivers for their drive time. And another thing that you didn't mention is that those hours, and again, many of these people are served for 1 to 2 to 3 hours at a time to do these tasks. We are not reimbursed for drive time However, we now, because of this Obama administration change, are forced to pay for drive time. So that's only going to make this issue worse going forward. So just wanted to emphasize that your points, I think, are well made. Thank you. Thank you, Mr. Chairman.
I just want to
Go ahead.
thank you, Representative Petrie, and that is absolutely an issue that I'm as well concerned about, because in the rural areas like where I live, it's difficult to find even one caregiver, much less multiple caregivers, because many of us on the ICWP waiver have enough hours such that prior to the implementation of this exemption that Representative Petrie mentioned, I could allow those caregivers to work more than 40 hours. But because there is no fiscal backing of that mandate, essentially, then it is also putting those of us at risk, because we need to find even more caregivers, because even though there's not a hard cap per se by the Department of Community Health to limit those hours to 40, there's no funding there, and so that's essentially what's happening. And so I just, thank you for bringing that up, and I ask you all to take that into consideration as well. I'm happy to entertain individual conversations with you, but that is very much an issue. It's for those of us impacted by disability on the waiver. It's providers and those caregivers who don't have a living wage. Thank you.
Thank you. Helen Sloat. If you would introduce yourself to the members of the committee and let them know who you represent today.
Yes, sir. Thank you. Good afternoon, Mr. Chairman and members of the committee. My name is Helen Sloat, and I'm here today on behalf of Easter Seals. Easter Seals has a number of chapters across the state, and one of the programs that they provide children and families is what they call Champions for Children. Champions for Children was initiated in 2007, and Easter Seals was selected through a request for proposal process and awarded the contract to manage that program for the state. The Champions for Children program allows medically fragile children to access some assistance with funding for their health care needs by first having the parent apply for the Katie Beckett waiver program. And once they're given a medical denial on the Katie Beckett program, they can then apply to the Champions for Children program. Champions for Children will allow families up to $2,000 on an annual basis for things such as paying for speech and OT therapy, paying for medically special foods, helping families with other just basic health care needs that they need to pay for their children. We would respectfully request that the subcommittees entertain an addition for this program of $250,000 in the amended budget, and we would also like that same amount in the 2017 budget so that they can meet the needs of these kids. There are about 344 children as of the end of December on the program, and we have sort of exhausted the funding that was initially set aside to fund this. So we greatly appreciate your help, and we appreciate the time to talk with you about this matter. I'm happy to try to answer some questions if the subcommittees have anything.
Thank you. Not seeing any questions from the committee. Anybody from up here?
Thank you so much.
Thank you for your presentation. Amy Losicero, is that right? If I butchered it, I apologize. And Ned Morgan's is next, so just so you know.
Okay. Mr. Chairman, distinguished member of this Appropriations Committee, good afternoon. I'm here today as a CIS provider who's been providing physical therapy services in the state of Georgia for the past 21 years. The past 17 years I've been the CFO of All About Kids Therapy Services that provides occupational therapy and physical therapy services for children in the Gwinnett County area suffering from orthopedic, neurological, and developmental disease and disability. I'm here today to ask you to support the Physical Therapy Association of Georgia's request of the Appropriations Committee to require Medicaid to align the CIS occupational therapy and physical therapy rates with the 2014 Resource-Based Relative Value Scale. As the name indicates, the resource-based relative value scales are based on the cost to provide services to patients. The rates are adjusted each year to account for changes in industry resources required to provide services and are utilized by Medicare in payment of their providers and private insurances when negotiating rates with providers. With the exception of a few SLP codes that are newer codes, most of the CIS provider rates are based on a 16-year-old resource-based relative value scale and have not been updated in 13 years. In fact, the OT and PT CIS provider has had nothing but cuts and added administrative costs in over 30 years. As you know, the past 13 years has brought significant change in healthcare across the nation. Our state has made great strides in its state-funded healthcare programs and opening its doors to cover more children than ever before. As a CIS provider, I appreciate the dilemma this put the state in. Serving more children meant increasing funding in programs at a time when state funding was experiencing significant cuts. However, the CIS providers have struggled over the past 10 years to adjust their practices to meet new requirements by the CMOs, DCH, Babies Can't Wait program, and new federal EMR standards, and many have not survived the changes. A recent survey of providers in the Physical Therapy Association, Georgia's OT Association, and Georgia's Speech and Hearing Association found that over 50% of the respondents either discontinued or have limited the number of Medicaid and CMO recipients they accept. This is causing huge waiting lists and a shortage of therapists in our early intervention services programs. My office has over 170 kids on its waiting list alone. I understand that there's others here that feel the same way about their professions struggling in this difficult healthcare environment, but I would argue that the CIS providers have taken on more than our fair share of the burden to open our doors to more children. I say this as one of the last companies providing PT and OT services in Gwinnett County's Babies Can't Wait program. My practice has served our community without prejudice of payer source for over 17 years. We have worked with the CMOs, DCH, and the Babies Can't Wait program to ensure evidence-based, cost-effective services are being provided, but we are now one more erroneous mass reprocessing or added loophole by the CMOs from closing our doors, and frankly, there's no one to really take our place, which is how we ended up one of the last providers. We are the sole provider of on the teams, the core teams in Babies Can't Wait. We have OTs and the only OTs and PTs in Gwinnett County for those teams. Not because, I would like to say it was because our company's so great, but it's really because everybody bailed out. My practice is actively serving over 828 children in Gwinnett County. 285 have ABD Medicaid, 248 are on some form of CMO, and 290 have private insurance. simple mathematics would tell you that these numbers indicate that 2/3 of our practice is Medicaid, which in itself would be more than our fair share of the state's burden. But in reality, it's actually far worse. For a majority of the 290 patients with private insurance also have some form of Medicaid or Babies Can't Wait, or both Medicaid and Babies Can't Wait. We have patients that we literally have to request 3 authorizations for, one for private, one for insurance, one from Babies Can't Wait. We have to track these authorizations. The beauty of the Babies Can't Wait program is that the consumer, doesn't matter if you're rich or poor, you're only going to pay up to the Medicaid rate. So the providers, basically the CIS rate dictates our entire practice rate. So what does this mean for the practices and the community CIS program that specializes in pediatrics? Over 90% of our patients require additional administrative resources over and beyond the typical private insurance patient, and yet we are receiving payment at a 40% discount. Committee members, I ask you today to help restore balance to the system and ensure a future CIS program for the children of this great state by allocating money to better support the CIS provider and voting to require the Medicaid align the CIS OT and PT provider rates with the 2014 RBRVSs. Do you have any questions? I gave you a bullet of the budget allocation that it would require for 100% and 80% of the RBRVSs. So.
Thank you.
That
Representative
helps.
Gardner, you have a question?
Thank you very much. I'm trying to understand exactly. These are services that are required by the Medicaid program through EPSDT or some other program. So they're required to be provided to children who are identified with these needs. Is that right?
Yes.
But these therapists, compared to other therapists, are not reimbursed at the same percentage of the federal RBRVS rate.
Correct. To the if you're comparing these therapists to the same therapist seeing a Medicare patient or a private pay patient, it's a 40% discount from the Medicare patient.
How about other therapists in Medicaid? Other providers.
Other providers. I believe I'm not sure. CISS might be is at the same rate. I'm not sure of the others.
So when you're asking for parity with other providers, 80% of the 214
RBRVS is correct. The Medicare rate
is what would give you parity with the other providers in Medicaid.
Well, the parity would be that other physicians in Medicaid are all aligned with the 2014 rate. We're the only physicians in Medicaid that are not aligned with the 2014
and by physician,
rate.
you mean providers who are
Correct.
paid directly by Medicaid?
Correct.
Or CMOs?
Or CMOs, correct.
Okay. Thank you.
Mm-hmm.
Any other questions from the committee? Hearing none, thank you for your testimony.
Okay, thank you for your time.
All right, Ned Morgans. Thank you. Please tell us again who you are and who you represent.
Okay.
Appreciate you coming.
Yes. Hi, my name is Ned Morgans. I represent, I'm currently the president of the Georgia Adult Day Services Association, which is also under the auspices of Leading Age Georgia. I also am provider for the owner of Sarah Care Adult Daycare Centers and Home Care in Johns Creek and Cobb County. And what we're here for is to ask the committee to consider a 5% adult day health provider increase for those involved in the disabled and elderly and disabled waiver for the fiscal year 16 amended budget. We'll go into a couple of details, but one of the issues that we feel is that a couple years ago, most of the other providers in home and community-based services were afforded a 5% increase, and the adult day health provider network was not. And so we feel like it's appropriate to bring parity to the other providers in this into this waiver program. A couple of issues that I think is important for the committee to understand for adult day health is, first of all, what we do is we are serving the elderly and the disabled community, and we're all throughout the state of Georgia. There are not a lot of providers that have been licensed. Right now there's approximately 100 licensed providers in the state. The size of our centers range from probably 10 to 20 all the way up to 50, 60, 70 or more in some cases. What happens in these centers is that individuals in the community come to our center. They have a wonderful day filled with social and recreational programs. They receive usually a breakfast, a lunch, and an afternoon snack, so that they're getting a lot of their food requirements there. The reason why Medicaid pays for this service through the waiver program is because we have to have licensed nurses on staff, and so during the day our nurses are providing various and sundry basic skilled nursing tasks. So that could be medication administration, diabetic blood sugar checks, in some cases trach care, colostomy care, all sorts of fun, wonderful things that nurses don't seem to care about. But most of the rest of us don't have anything to do. One of the challenges that we've had is that since 1998, there has not been an increase in that rate fund. And since 1990, and since 2012, according to the National Adult Day Services Association, and then Elaine Wright who oversees the licensure for adult day health at the Health Facility Regulation Division at Department of Community Health, there have been approximately 15 to 17 centers who have closed in the last 3 to 4 years. One of the major reasons is that the costs that providers have had have continued are outstripping the ability for providers to provide that. I'd like to say that this is more of a rural issue than a city issue, but the centers have had a lot of trouble in the Atlanta area, and they have a lot of trouble in the rural areas. And so the other issue to realize is that the CCSP program has basically been on a freeze for the last, probably will be a total of 18 months. And a lot of centers are feeling a lot of pain. And so right now I probably know of at least 5 to 7 centers that are in significant stress financially because we're not getting anything close to replacement folks from the Medicaid programs that we used to have, and even so, those are generally going to be subsidized by private pay and other forms of payments. And so what we're finding is that probably the best deal of elder care and disabilities care in the state is really under a lot of pressure. We're looking at probably another 5% providers that are at risk of closing. in terms of the hourly care that it's providing, if you assume an 8-hour day, the money that's involved with that is approximately $6.30 to about $7.90. Much more, much less expensive on average than you're going to find almost anywhere else, any other options there. And this is going to be a bigger issue as the stresses for caregivers increases to expand, as Representative Petrie noted. There are no restrictions on overtime, so you need a lot more folks to do this. And we think that we can continue providing the state a wonderful value, but we need some help. And we think that there's a 5% catch up to what the other providers received really is a good place to start. On the back of the handout I gave you are some numbers that DCH provided to the Georgia House Study Committee on Adult Day Services that was conducted this past fall. And the 5% for the amended budget is a recommendation of that study committee. The number that you see there would be a total for a year increase. And so obviously for the fiscal year, this amended budget, it would be a lower amount. This would be subject to the FMAP. And so certainly our state dollars are going to be significantly less than the total number that's here. And so a little bit of investment in adult day health providers is going to go a long way to protecting the provider infrastructure in the state of Georgia that's providing great care for so many seniors and disabled individuals. If there are any questions, I can.
Thank you for your comments. I don't see any questions on the board. Any questions up here? Okay, thank you.
Thank you very much.
Pat Madry.
Thank you. Good afternoon. My name is Pat Madre. I'm the owner of Autumn Care Adult Day Center in Augusta, Georgia. I will try not to be redundant to what Ned has presented, but I am here today as the board representative for the Georgia Association of Community Care Providers, a professional organization that represents programs that serve individuals to stay in the community, with community care costing approximately a third of the cost of what institutional care is. That program originally started, the Georgia Association of Community Care Providers, I'll shorten that to GOSSIP. They initially were providers of elderly services, but it's expanded. We do have members that are ICWP providers. We have DBHDD, array of providers. But under the umbrella of CCSP, you'll hear the Community Care Service Program referenced, that waiver. You'll hear the SOURCE program referenced. There are 7 community-based programs, and those are the Emergency Response System, the Help I've Fallen and Can't Get Up button, the home-delivered meals, the personal care homes. There's 7 that fall under that umbrella of community-based services. Adult daycare is one of those. And as Ned mentioned, it has been since 1998, which that component of service has received a rate increase. Some of the other programs have been able to see some rate increases, but we have not been able to receive that up to this point. So we are desperately needing attention to that matter, as we've seen minimum wage has incrementally gone up three notches since 1998. Of course, insurance, meals, any cost of living that you've experienced, because we do have the sticks and bricks, as they say. The individuals come to our center during the day, and they're able to go home in the afternoons. When I first opened up my business, I thought, I'm here to take care of these individuals and these people that need help. But what I've quickly realized is we are there for caregivers as well. Without us being available for caregiving throughout the day, they may have issues with jobs seeking employment or maintaining employment. Certainly, as we talk about the sandwich generation, where people are caregiving for their parents and their children at the same time, they need help. So adult daycare is so comprehensive because we do have the medical oversight, we have the nurses, we have the nutrition, we have the safety throughout the day, plus the overall well-being of getting up, getting out, and being somewhere among peers and just activities. The social component of it is important, but it's not the most important. As we have served people over the last 20 years, to be part of CCSP, nursing home eligible has always been a term that you needed to be nursing home eligible in order to be on the CCSP program. That nursing home eligible has changed. The people that we are caring for today are requiring much more medical oversight. They are more frail elderly. The needs are greater. We've diversified to be able to sustain. I do serve under CCSP. I serve under SOURCE. I serve the DBHDD waiver. I serve through the VA. I've written a grant. Because I'm on the river, I can actually see some South Carolina Medicaid folks. We have had to diversify to be able to sustain and be able to continue to provide services. So we just come today and just please ask that you consider that 5% rate increase as a starting point, as we need to come to a point of kind of catching up. And so we just would ask that you consider that this time. Thank you.
Thank you for your testimony. Let's see if there's any questions. There we go. Representative Gardner.
Thank you. Is this the group that is the audits that were in all the news? Were the audits of the members of your association? Have you had any recent issues with the state auditor or the DCH auditors?
You may be referencing, I think there's been some attention to the challenges through the DBHDD program. Is that maybe what you're referencing?
I don't know. There were a lot of issues in the news about audits of these kinds of programs for people with disabilities. And
one thing that we have seen, especially through one particular waiver, as we've diversified, there's actually adult daycare. The last year is the first year that we've been licensed through healthcare facility regulation. That does not mean we have been lacking oversight, because every waiver, every grant, everything that you participate with, there's oversight through that. I do know there has been some concern with the DBHDD program. There is a lot of
through
regulation.
The Department of Justice oversight waiver.
Yes,
Yeah.
that's the Department of Behavioral Health and Developmental Disability, and that the Department of Justice has been involved in that. But there's a lot of
how has that impacted the people in your association, I guess is my question.
Again, that's one of those waivers. Not everyone chooses to participate with the Department of Behavioral Health and Developmental Disability, because the regulation and the oversight is very challenging. It's very difficult. That is one of the things. The cost of providing care to diversify into a waiver such as that is very costly, because there tends to be a lot of paper care versus people care. I hate to say that, but that does happen. And those things are very costly. But that particular waiver is probably the one that you're referencing.
Thank you.
Do y'all agree?
Petrie.
I think so.
Representative Petrie.
Thank you, Mr. Chairman. I was just going to speak to what Representative Gardner, the question she just asked. Those are clearly the issues that have been in the media lately were DBHDD. They're different waivers, and they're really, even though they're day programs, they're completely different altogether, and they have different funding sources. But there's been a lot in the media about their compliance and the way they're being audited by the Department of Community Health. And we included a lot of that in our study committee. If anybody's interested on intellectual and developmental disabilities, we had a study committee with some good recommendations on that. Thank you.
Thank you.
Thank you for your testimony. Amy Hughes.
Good afternoon, Mr. Chairman and members of the committee. My name is Amy Hughes, and I'm from Savannah, Georgia, with Hughes Public Affairs. See my state representative out there, Representative Jesse Petrie. And also Representative Ron Stevens was here, Chairman Stevens, so I know y'all are Savannah is very well represented on this committee. I'm pleased to see that. I've spoken with Representative Petrie about this already, but I represent Shire, which is a pharmaceutical company that makes the ADD medication Vyvanse. And on October 1st of 2015, WellCare and their PBM, Pharmacy Benefit Manager, Caremark, they eliminated Vyvanse from the preferred drug listing for their Medicaid managed care patients. And then they essentially created a very burdensome process for children to be able to go back to the drug that was working for them. And when they go to their pharmacies, the rejection code that seems to be coming is drug not covered. Now, I'm not here today to discuss the public policy implications of this with you as far as from the perspective of the inconvenience that this creates for the child, the family, the teacher, all of those. And I don't want to discuss the impact on the continuity of care when you're on a medication and somebody suddenly takes it away from you, how pointless that is. But I did want to bring to your attention that Shire's estimates of the impact to Georgia's Medicaid unit rebate amount, the drug rebate that now goes directly to the state, is $3.5 million annualized. And I just thought that that would be something that this committee would like to ask DCH about, if they could get you their estimates and if their pharmacy benefit manager could tell you what, in fact, that hit to the state will be as a result of this decision. Thank you.
Well, thank you. Any questions from the committee? Let me get your mic on 1 second.
$3 million rebate to DCH. What's the total cost of the drug before the rebate to the state? Do you know?
I've got some numbers I can show you, but as you know,
show me later then. Yeah,
absolutely.
Be interested in that. Thank
Glad to.
Okay, that ends our list of people who've requested to testify today. I want to thank Chairman Parrish for keeping me straight here today, and appreciate the members of the Committee on Appropriations on the House and Senate for your participation. Any further comments? Elder statesman? Okay. All right, the Health Committee Appropriations has a joint meeting at 8 o'clock in the morning. Don't forget. Thank you all for your attention.